So one of the things that I think sets May Grant apart from a lot of the other practices is our team of nurses called the Nurse Care Coordinators. I'm Pam, I'm a registered nurse, and I am part of that team. The team at May Grant is here for you when you call with a problem, a concern, a question, or even in need of some education. You'll be able to speak with a nurse. We can speak urgently to urgent problems. We have spoken to women in labor. We have even helped deliver babies by talking to husbands in the car when they haven't reached the practice in time. And anyone that's not urgent, we try to return a call within 1 to 2 hours to make sure we can meet your needs. Our main job is just that, working to help you navigate successfully through your health journey as a woman. The journey can begin as a teenager and go through your entire life with well woman care and problem care. May Grant will be at your side and on your side. If you come to us as a teenager or a young woman, you might be coming for period issues or a need for birth control. A few years later, we'll help follow and guide you through a pregnancy and delivery. Eventually, you might get to menopausal issues or issues that mature women have with bladder concerns or something like that. Each care provider has a nurse care coordinator working with them to help manage communication between client and patient. As a nurse care coordinator, I'm here to give that personal touch so you don't feel just like a medical record number. I get to know the clients that follow with my providers, and that is so helpful, not just to have a consistent provider for a chronic condition, but also to have a nurse who gets to know you and who knows that provider and is able to communicate well with long-term health issues. May Grant's a large practice. We have a lot of doctors, a lot of midwives, nurse practitioners, and they can help guide you through that journey. But because this team is so big, it's really nice to have that personal touch to help with that large number of providers. And I think that's the best of both worlds. You have lots of options. You have different personalities in providers. We have lots of locations, lots of services that we can provide. But you also have your nurse care coordinator to provide that personal touch. If you have a specific doctor that you follow with, you can get the extension to that team's number. You can call them whenever you need them and reach your specific team. If you don't know, you can just call our main office number and they will guide you and they'll forward you to the correct team. My team, my providers, Dr. Crespin manages a lot of our older patients with bladder issues or incontinence, so I really get to know more about those issues and work with those as well. I deal with a lot of the interstitial cystitis patients, and I also work with Barb Good, whose specialty is women's sexual health. So I get to know those patients, the kind of questions they're going to answer, and a lot of times I can help those patients without even talking to my provider. I know what the answer is going to be, but I certainly can communicate back and forth with the provider as needed. Other ones have different specialties. There's one of our teams that deals more with the infertility patients. I'm trying to think. Some that their providers do a lot more of the DEXAs and maybe menopausal hormone replacement. Just really depends on the team, but we each have something that we're a little bit more specialized with, and we can provide input to the other teams when they need special input about something. Okay. We're here and we're happy to help with any kind of education. That's something that I really enjoy. And a lot of that is in prenatal patients and our pregnant patients, especially first timers that don't know as much. We're happy to guide them to resources, to give the answers that they need, and we never look at those phone calls as a problem. That's the part that I enjoy most about my job, is just working with people and helping them to find the answers that they need. So it is never a problem to call and talk to one of the girls on these teams, because we all are happy to help. And any other point in your life, whether, we're always here. We're always happy to educate, to provide resources. Some of those resources might be online. Some of those resources might be through the May Grant website, but we can always help you navigate and find the things that you need to know to make your health journey more successful.